Hi, welcome back to Student Nurses Success, where we're going to talk about blood pressure on this video. Remember, you can find a link to the maps in the comments section. Let's go ahead and get started. I think it's important that we first really talk about the pathophysiology behind high blood pressure. High blood pressure is way more common than low blood pressure, although we will talk about blood pressure because it is a problem for some individuals. When we're talking about high blood pressure, the patho really helps explain what's going on. Now, when your blood pressure is high, your body vasoconstricts its vessels in order to really protect your organs from that high flow. When you vasoconstrict those vessels, it actually starts to decrease your renal blood flow. When your renal blood flow is decreased, meaning the blood that's going to your kidneys respond by increasing renin. They do that because they assume that you don't have enough blood volume, and they're going to actually start the RAS system, when in fact that isn't necessarily true. So as renal blood flow decreases, the kidneys release renin, and that renin starts the conversion of angiotensin 1 to angiotensin 2, part of the RAS system. When angiotensin 1 is converted to angiotensin 2, it does two things. The first thing it does is vasoconstricts the vessels even more. The second thing it does is it increases aldosterone, which causes your increase in sodium reabsorption. Now, we know that whenever you increase aldosterone and increase sodium reabsorption, water goes along with it. So now you start to retain water. This retention of water increases your blood volume. And when your blood volume increases, that increases something called preload. Remember, always think of preload the same as fluid volume. As we increase preload, what we do is we increase the volume of blood in your body so that we can actually perfuse a little better. The problem is that increases the work of the heart. If the heart has to pump more, the heart has to work harder. When the heart has to work harder, it actually over time can start to wear it out, and we can actually over time see a decrease in cardiac output if the heart is not strong enough. Now, in most normal, healthy individuals, the body can manage that increased preload. But over time, when you have high blood pressure, you're actually going to weaken that left ventricle and cause a decrease in cardiac output over time because the heart has to pump against that high systemic vascular resistance. Now, let's go down the left side. Remember, you're already vasoconstricted because when you have high blood pressure, your organs are just going to vasoconstrict. But when you increase renin and the conversion of angiotensin 1 to 2, you vasoconstrict even more. When you vasoconstrict even more, it increases your blood pressure. And that increases your systemic vascular resistance, which means your heart has to pump harder against the resistance. We also know that when you vasoconstrict and your blood pressure goes up, your body's response is to protect its organs. So it's actually going to end up vasoconstricting and decreasing renal blood flow as well. And we already had that to begin with. This decrease in renal blood flow over time will damage your kidneys, and that will cause them to not be able to get rid of sodium, and it'll cause increased sodium retention, which we know leads to increased blood volume, which increases your preload, the workload of the heart, and over time weakens the heart and decreases the cardiac output. So really, the gist of what's going on is whenever there's an increase in blood pressure, vasoconstriction occurs, and that's to protect the organs. The problem is this vasoconstriction leads to decreased renal blood flow, which starts your RAS system, which starts this cycle all over again. So what happens with blood pressure is that we have this vicious ongoing cycle that we can't break. Now let's talk about the classification of high blood pressure. High blood pressure is in different categories, and we use this to help us streamline treatment. Normal blood pressure would be less than or equal to 120 over 80. If you're in the elevated range, you're 120 to 129 over a diastolic of less than 80. When you enter what we consider stage 1 hypertension, your blood pressure is between 130 to 139 over 80 to 89. Stage 2 is greater than or equal to 140 over greater than or equal to 90, and a crisis is greater than 180 over greater than 120. Now, we usually take several measurements of blood pressure before we categorize and say you have high blood pressure. So you may take 3 or 4 separate blood pressures at different times of the day. It's normal for people to have elevated blood pressure here and there, depending on what's going on. But a sustained elevation over time is really how we categorize high blood pressure. Risk factors for high blood pressure and developing high blood pressure center around these 6 things. First is diet. A diet high in sodium causes that increase in fluid volume retention, water retention, which increases your preload and over time is going to increase your blood pressure. We know that stress and the stress response increases the release of catecholamines, norepinephrine, and epinephrine, which increase vasoconstriction and also increase heart rate, contributing to high blood pressure. Alcohol always increases blood pressure too over a period of time. So, regular alcohol intake will lead to increased blood pressures. So, if you do have high blood pressure, reducing your alcohol intake would be helpful. Obesity increases the workload of the heart and also contributes to high blood pressure. Type 2 diabetes can contribute to the development of high blood pressure because we know diabetes alters the kidneys over time, and we know that kidneys are responsible for maintaining fluid volume and blood pressure status. And kidney disease. Kidney disease leads to the increased production of the renin angiotensin aldosterone system, which leads to sodium and water retention. Now, high blood pressure will lead to kidney disease, and kidney disease alone will also lead to high blood pressure. They do go hand in hand. Now, there's primary hypertension, which the causes of that can be genetics, diet, obesity, and just idiopathic. We don't know why, but some people just seem to have high blood pressure. You can also have secondary hypertension. Secondary hypertension is due to another disease process. Maybe you're taking a medication that raises your blood pressure, or maybe you're pregnant and your blood pressure's up because of that, or maybe you have kidney disease that is causing high blood pressure. In secondary hypertension, if we can resolve the issue, the main issue, then we can then take away the high blood pressure. In primary hypertension, we really can't do that. Now, it's important to treat high blood pressure because with high blood pressure, some of the outcomes that we see are related to end organ damage from high systemic vascular resistance. We also see the kidneys getting damaged. We see that because the kidneys are damaged, there's an alteration in fluid volume. And we know that that will worsen high blood pressure because it increases preload. We also know that with high blood pressure, we have this increase in left ventricular pressure. Your left ventricle has to pump against this high systemic vascular resistance, and that over time is going to weaken the heart and lead to heart failure. Over time, that heart failure is going to actually decrease your cardiac output. It's going to cause a backup of blood and cause other issues that aren't going to help with your blood pressure as well. The risk of hemorrhagic stroke increases with high blood pressure. Remember, stroke has 2 causes: ischemic stroke, which is from a clot, a thrombus, or an embolus. And also, we can have a stroke from high blood pressure or hypertension, where the vessels under pressure just actually start to leak and bleed. We also know that high blood pressure accelerates atherosclerosis and increases the risk of cardiovascular disease, the development of coronary artery disease, myocardial infarction, and stroke, which is part of cardiovascular disease. And also, high blood pressure will damage all vessels in your body. When they're under pressure, they can start to leak and bleed, and especially the tiny vessels in your eyes, causing retinal damage and possibly visual problems. As far as treatment for high blood pressure, it really is centered around decreasing systemic vascular resistance. Remember, systemic vascular resistance is blood pressure, so medications to reduce blood pressure, and also to decrease preload or fluid volume, maybe medications such as diuretics, and also lifestyle modification, maybe diet, reducing sodium intake, reducing weight, reducing stress. And also, we want to, minimize smoking or stop smoking and decrease alcohol intake. All of these will help. Now, let's talk about low blood pressure. Low blood pressure is, although it's not as common, it is very difficult to treat. It's really hard to raise low blood pressure in some individuals. The patho behind low blood pressure is possibly related to blood volume. Maybe you don't have enough volume, you're dehydrated, and it's causing low blood pressure. Maybe you're bleeding out, hemorrhaging. So these are usually more short-term problems that lead to low blood pressure. Some individuals just have a hard time maintaining blood pressure, and some of this is related to baroreceptor response. So, your baroreceptors in your arteries, like your aorta, actually sense when volume goes down or blood pressure drops. So, when you go from sitting to standing or from lying to sitting to standing, when you do that, gravity pulls down that volume and your baroreceptors respond by tightening. However, in some individual, that baroreceptor response is not as strong, and maybe they don't tighten or vasoconstrict. We see this as we get older. Older adults may have problems with this, and some individuals just have issues with this in general. The other causes of low blood pressure can be medications, like maybe blood pressure medicines, maybe diuretics can be a cause of this as well, and other medications that can lower blood pressure. Arrhythmias can lower your blood pressure because they decrease cardiac output, which leads to decreased blood pressure. So if you have a cardiac arrhythmia and it's affecting your blood pressure, then that arrhythmia needs to be treated. And we know some endocrine or hormone diseases such as Addison's disease, which decreases aldosterone, which leads to decreased blood pressure. Manifestations of low blood pressure include dizziness, blurry vision, fainting, and the big one is falls. And so I have a picture down here to remind you, falls are really one of the outcomes that we're concerned about with low blood pressure. People can get hurt when they fall. Other manifestations, weak pulses, decrease in cardiac output, and obviously you'll see that decrease in blood pressure. Some individuals have orthostatic hypotension, where when they move from one position to the next, their blood pressure drops. And that is defined as a drop in systemic blood pressure of more than 20 points, a diastolic of more than 10. And with that, we see a coupled with an increase in heart rate of maybe 20 to 30 beats to try to compensate for that drop in blood pressure. Again, outcomes, the big problems are fall risk, syncope, or fainting, and we see decreased tissue perfusion to the body. And there you have it, our nice summary of blood pressure. Remember to subscribe and like to our videos so that you can stay up to date on all our new ones. Thanks a lot. Have a great day.